Good day, everyone. I'm going to demonstrate on how to do the intravenous therapy. So first of all, we have to know what is IV therapy. So IV therapy is the use of needle, cannula, or catheter to be inserted in the patient's vein. So we have to know the reason behind why we have to do or why there is a need to do the IV therapy. So this is mainly because IV therapy enables the patient to be hydrated, especially if the patient has a disease or can no longer have an enough volume of liquid in his or her body. And also, this is one way of parental nutrition. So when you say parental nutrition, this is needed during labor or during delivery of a mother, because we know that during or through IV therapy, it can give more or enough nutrition to the mother, especially during her hard times, especially during labor, I mean. So another one is that it is used in administering medicines. We all know that IV therapy is very very useful in administering medicines or any medicines that we need in our body. And lastly, this is used for blood transfusion. So if a midwife or such a certain medical professional fails to follow the correct procedure on how to do the IV therapy, then there will be a complication, or the patient will have or will experience complications during the entire procedure. So for today's demonstration, I am with Miss Abigail Joy Dorilac as my acting patient in my IV therapy. So first, we are going to prepare all the articles needed. So during IV therapy, we need this solution. So I have here the hypertonic solution, which is the dextrose, and I have also my intravenous tube here, and also my gauge 22 gauge 22 cannula, and I have also my tape to be used in for the to be used during the or in the cannula. And also I have my we have here the cotton with alcohol, and also my sterile gloves. And I do not have the tourniquet, but I am going to have an alternative, which is to use a balloon. This is a cut balloon, so I'm going to use this as tourniquet. And if you are wondering why I have this cup, I have this cup because I will use this as a drainage during my priming of the IV. So first we have to read, or second, I mean, we have to ask the patient's permission about our procedure. So here I'm going, if the patient will permit us, then we will, or I will going to explain to her about the procedure. So ma'am, is it okay if we will be going to have an IV therapy in your IV insertion in your arms or in your hands?
Yes, it's okay, no problem.
Okay, so we're going to do this by inserting a needle in your hand. So first, we will settle this first, our dextrose, our hypertonic I mean solution. So we will hang this one. Sorry, we are in our house, so we'll just try to. And don't forget that we have to put a label. There's a name of our patient, the date, the kind of solution, and also the time, so that the next nurse who will be in shift can be or can easily monitor this, or can easily know what type of solution or what medication we give to our patient. So here, no, we have to open this, okay, because this part we will insert our spike. This, we already open it, and then we will hang this one. And I have this my IV tube. IV tube has many parts. So this one, this is the spike. Always remember that a spike is used to attach or insert to the solution or to the IV bag, because using this, the medication will easily flow through the tube down to the bloodstream of our patient. And always take note that if you see that a particular spike has a plastic cover, this means that this area should be sterile, should remain sterile. So we can only get the cover here during the time that we will insert it. But if we will not insert it yet, then don't try to get the plastic cover. And we have this little door. This is used for air entrance. If there's a need for your solution to have a small amount of air, then it should be open so that the small portion of air can enter your solution. And we have this drip chamber. Here we can see the flowing or the drops of our solution. And this is the body of the tube, and we have here the drip clamp, or should I say this is the roller clamp. This roller clamp is used to you will use this if there's a need for you to control the rate of your fluid, if there's a need for you to control your fluid. And also this one, we have the injection port. If there's a need for the injection, you will put it here. And this, lastly, this is the lower lock and adapter. This one will be attached to the patient's arm or cannula. So here, first I have to do the aseptic technique before I forget. So since I'm done washing my hands, I will use alcohol to cleanse my hands. And always follow the correct rule on how to do that. Since our pharmacy has no enough 6.5 size, then I'm going to use this one, 7.5. So this is somewhat bigger. So here we will insert our spike in our solution. So it should be, this is sterile, and once we will get this, or we will remove the plastic cover, this flow here. And after this, we will put a half part of our chamber or our drip chamber of our solution. So just squeeze, there's a small portion, squeeze this one half. And after this, our roller chamber, we will open this one so that our solution can easily flow in our tube. So this one, it flows already here. And we need to, what do you call this one, we need to get the, there should be an, too much water, no, too much solution, but it's okay since we already, there's no more. Then we will adjust this so that we can get the air in our solution, because there should no be air, or an air is not what we call advisable to have in our tube or in our IV, so that there will be no air embolism or no happenings of air embolism in our patient. So this one do not have, this one is good, so we will lock this and we'll just put it here, because once we're done with our cannula, we will attach it in our patient's hand. So we're going to find a good vein in our patient. So ma'am, are you right-handed or left-handed?
I am right-handed.
So we will use your left part. We will use your left part. Okay, you will sit here and I'll sit. Okay. So since this is our patient's non-dominant hand, we will try to locate the good venipuncture site here. So when you say the good venipuncture site, the one that has a good vein. And in looking for a vein, you have to consider the condition of your patient and also her age. So my patient is 11 years old and she has a good condition, so it's okay to have an IV therapy. And also, you have to consider also the size of the vein. It should be large enough or larger than a natural vein, so that, or a normal vein, so that your solution can easily penetrate or can easily flow in your bloodstream. So I'm going to use this alternative tourniquet. So ma'am, just put it here and I'm going to put a tourniquet so that we can easily find a good vein. And can you make your into a fist? Okay. So don't slap the hands of your patient. You just have to feel the vein and also tap it swiftly like this. So look, our patient has a straight vein here. This is a good vein to be used. That's why we will use this one. And sorry, I have large gloves. And we will put our solution in, or no, the alcohol in a circular motion. This before injecting or before inserting our cannula from inner to outer. Okay, done. So here, this is the vein that we are going to. Always remember that your equipment should remain. So this is, or my, this is gauge 22. This has a small only. Okay. Part of this is the needle and this is the catheter. The needle will be inserted in our patient's hand and we will remove it, and only the catheter will be penetrated or will be put in our patient's vein. So take note, I'm not going to insert this since not good enough in inserting IV or intravenous. We'll just have to demonstrate on how. So this this is the vein I'm looking. Since this is the vein, your IV or your cannula should be 15 to 30 degrees and bevel up. Once this is 15 to 30 degrees, this one like that, you will insert it to the vein of your patient, and once there is a backflow here, you will remove your needle through getting like this, like that, and you are 15 to 30 degrees, then if there is a backflow, you will already flatten it or lower your angle so that the catheter will be straightened to the bloodstream or to the vein. So here, from like this, bevel up, and 15 to 30 degrees, you will lower your, this is 15 to 30, you will lower, so like that, and get your needle and dispose your needle, and this one will be in your bloodstream. This one, avoid 15 to 30 degrees gihapon if your, what we call that, if there's a backflow, because it means that you will hit the vein wall, and it should not be like that. Since you are already assuming that this is already put here, you will have to put the tape. So for an example, you put the tape here. You put the tape in the wing. Like that. Wait. Put the tape. And also here, put the tape. Always remember that you have to hold this one so that your blood will no longer have the pressure to come out. Like that. We are just assuming here, okay? Then open your, what do you call this, the lock, and put the lower adapter here, and you're good. This one, the dextrose is already penetrating in our patient's bloodstream, and this is very important so that our patient can have more nutrition or nutrients, especially during the time of being ill or being sick. And afterwards, if you're done, make your patient in a comfortable position and thank her for letting you or giving you the permission. So thank you, ma'am, for letting me do the IE. For letting me do the IE, and afterwards, thank you, ma'am. Thank you, ma'am.
You're welcome.
Then after, you will have to, or the post cleanup, you have to clean all the mess that you do. So that's the rule in having the, or that's the steps on how to do the IE and also on how to prime your IV set. So thank you so much, and God bless.